Die kardioloog Dr. Nqoba Tsabedze kuier vanoggend saam om oor hoë bloeddruk en die gevare daarvan te gesels. So good morning, Dr. Tsabedze, and welcome.
Good morning, everyone, and thank you for having me this morning.
So I would like to start by asking you, how do you define hypertension and what causes it exactly?
So hypertension is an elevation in your blood pressure that actually occurs as a normal process of aging. However, in a lot of individuals, this happens quite prematurely, and it's caused by hardening of your arteries. And this hardening is accelerated when you eat unhealthy foods. You may have a genetic predisposition in the family. You basically are predisposed to it. Other risk factors such as obesity, all of these will lead to an elevation in your blood pressure. And when your numbers are above 140, which is the top number, systolic blood pressure, and above 90, which is your bottom number, then we diagnose you as having hypertension.
So what would you point out as the main risk factors leading to hypertension?
Yeah, so fortunately for all the cardiovascular conditions, hypertension, stroke, heart attacks, they all really have a common set of conditions that are risk factors. So in South Africa, for example, leading a sedentary lifestyle, increase in salt intake in our foods, in people of African origin, so Black patients particularly, they tend to have a very low risk threshold of actually complicating with hypertension, having high saturated fats, eating a lot of processed carbohydrates. All of these work together and predispose you to hypertension. But I want to highlight that the most common form of hypertension is what we call essential hypertension. So as you get old, your blood vessels harden, your blood vessels lose their compliance. So if you consider a balloon, you're able to blow a balloon and the balloon expands. And as you get older, if the balloon will then get a bit hardened. So when you're trying to blow air in that balloon to get it to the same size as you previously did, will require you to put more pressure and more force and air into that balloon. And that's the same thing that happens, and that's called essential hypertension. So it's a condition very common in the elderly and with increasing advanced age. Then we have another form of hypertension that we see in younger people, usually children. This is called secondary hypertension, and usually these conditions can be diagnosed and treated. For example, if you have an adrenal gland problem, that can be diagnosed, or if you have a kidney problem, also that predisposes you to hypertension, which can then be treated if the kidney problem is resolved. So there's primary, which is essential hypertension, and then secondary, which is caused by all these other causes, which we can also treat. Before I stop answering this question, I just wanted to highlight there are also medications that if you buy over the counter can predispose you to hypertension. So if you abuse non-steroidal anti-inflammatories, so if you, that patient who constantly has a lot of joint pains, ankle pains, fingers, nails, etc., you use a lot of non-steroidals, you're also predisposing yourself to hypertension. So there are also other common concoctions that we can buy over the counter that can also predispose us to hypertension.
Dr. Tsabedze, what is familial hypertension?
So familial hypertension is when you have a family history, and this is usually a part of the conditions that I call secondary forms of hypertension, but it can also happen as a form of essential. So generally, if in families where hypertension occurs at an early age and it tends to be quite prominent, so for example, your grandmother had it, your uncle has it, your father has it, you now have it, chances are you probably will pass it on to your children. Then we call that as familial hypertension. So it's when the disease actually runs within the family.
And I would also like to ask you, I mean, when taking a look at the current hypertension statistics, how does South Africa compare to the rest of the world?
Yeah, so globally, in fact, management of hypertension is very dismal. So one would consider this condition as very common, as something that by now we should be mastered. You know, it's easy to put on a blood pressure cuff and get a number and a reading and to be certain that you have hypertension. But what we're learning is that because of the lack of insights and also because of the lack of symptomatology, patients have hypertension and they're not in pain. The BP is high, and then suddenly, boom, he collapsed. He had a stroke, he died, or boom, he had a heart attack. And we wonder why. He didn't smoke. He led a healthy lifestyle, or reasonably healthy lifestyle. So what was the problem? And the problem was the blood pressure. So in South Africa, which is shocking, we have single digits. I'm talking less than 10% of patients who are controlled. So by and far, the way we approach hypertension is that if you consider the whole population, in South Africa, there's about 60 million people. Approximately 30% of the population is living with hypertension. Of that 30%, the majority have not been even screened to diagnose hypertension. Those who've been screened and have been found to have a high blood pressure, that means a blood pressure numbers of 140/90 that are high and above, they have not been told you're actually hypertensive, and they have not been started on treatment. But then the sad part is even where the doctors know, and this is now I'm also responsible for this, where doctors know the blood pressure is high. Often even the physicians don't act. We don't start treatment. And normally if you go to any general practitioner or hospital, the first thing they'll do is take your blood pressure. But if the numbers are above 140/90, that should raise a red flag to say you are at risk, you probably have hypertension, we need to screen you and do 3 more readings, or you need to come back and check that reading. And if that number is very high, say 180/100, you don't even need to do more readings. You are instantly diagnosed with hypertension, and we need to start treating you. And the problem then is we don't start treatment. The other challenge is that traditional guidelines, how we treat hypertension, used to tell us that we should start with one agent and start low dose and see how the patient does, and then increase to full dose and see how the patient does. And if they're still not controlled, then we can add another agent, low dose. So it was a very much stepwise, staggered approach. But what we really want is to control the blood pressure. So now we have evolved our thinking, we have renewed our thinking, and we believe that if we use 2 agents that control blood pressure from different mechanisms, those 2 agents can basically then control the blood pressure early. Furthermore, we've also learned that lifestyle changes, which are good, everyone should be leading a healthy lifestyle. Regular exercise, cut down your salt intake, reduce your processed carbohydrates intake, cut down animal fat intake. Those are healthy things. But we know that for most patients, that alone is not going to be sustainable long-term to control the blood pressure. And also, the last point I wanted to add is that it's not just about the numbers. Often patients feel, oh, my numbers are high, but I'm okay. There's nothing wrong with me. Why should I take all these tablets? It's actually about preventing the cardiovascular events. What we're really preventing is the stroke, it's the heart attack, it's the kidney disease, it's the peripheral vascular disease. Those are the things that we are preventing by controlling the blood pressure early and timeously. So it's important for all the clinicians and even the public to be aware that it's a simple thing as numbers in terms of your pressure that we are worried about. You're not feeling any pain. But what we really want to prevent is you from getting a stroke, a heart attack, heart failure, kidney disease, and peripheral vascular disease. And hypertension is only but one of the cardiovascular risk factors. There's also high cholesterol problems. There's also diabetes. There's so many other risk factors that we can also target, which cause a similar manifestation and complication as hypertension.
Is there a link between hypertension and COVID-19 at this stage?
Yes. So what we're finding is that patients who are actually hypertensive are at high risk of complicating with severe COVID-19. So severe COVID-19 disease is the form of COVID-19 that no one wants to get, because you end up in hospital, you end up in ICU, and now you need to be on a ventilator. It's prolonged recovery, and frankly, if not timelessly managed, and if your body doesn't respond to the supportive measures, you probably may even die from it. So there's definitely an association between being hypertensive as well as having other cardiovascular diseases and you complicating with severe COVID-19. And with that said, we encourage all our patients who are hypertensive to actually continue treating and taking their therapy. I know during the COVID-19 pandemic and the high waves when we were on the various lockdown phases, we were preventing people from moving around. Some may have struggled to get access to health care, access to their medication. But we really insist that patients mustn't be complacent about it and think, oh, it's just my blood pressure numbers, it's nothing serious. It is serious, because if you get COVID-19 and you're hypertensive and you're poorly controlled, you are at risk of complicating with severe COVID-19. And furthermore, with those individuals, we would strongly recommend that they get vaccinated, because we know that they have an additional risk for complicating with severe COVID-19. And so the vaccination could also help them to protect them from complicating with severe COVID-19. One of the tablets that we use for hypertension management are called RAS blockers or ACE inhibitors. Some of them, for example, the common names may be enalapril or Pharmapress, other therapies like perindopril, ramipril, Prexim Plus would be one of the names, for example, trade names that maybe others may be aware of. And there's been a lot of thinking and concern that COVID-19 uses some of the receptors that these drugs seem to work by to enter our body and basically to multiply. And so there was a frenzy globally that these tablets could be putting patients at risk and facilitating patients to transmit COVID-19. But a lot of studies have been conducted now, even though we've only had COVID for about 2 years, that have shown that RAS blockers or ACE inhibitors are all safe. And in fact, they protect patients. So if you are on an ACE inhibitor and the drugs that I mentioned earlier, please do not be scared. Do not fret. Continue to take these therapies. They are beneficial and they will help you live long.
And then lastly, and in essence, what is the foundation doing to eradicate the current statistics in South Africa?
Yeah, so as you can see, this condition is very common. I mean, if I say we've got 60 million people in South Africa and there's about 30%, sorry, not 30 million, 30% living with the condition. So we're looking at plus minus 20 million in our country. It's a lot of people. A lot of these individuals don't even know that they have hypertension. And so there's a lot of, first of all, awareness and public awareness to say, know your numbers, get measured, get your blood pressure checked. And if your blood pressure is high, above 140/90 and persistently above 140/90, you need to be on treatment. Yes, it's not nice. There's a stigma that patients have about taking treatment. Even individuals who are feeling okay and they're told, oh, you're hypertensive, you need to start taking treatment. It's not a nice thing to do. But what are we preventing? As I said, we want to prevent strokes, heart attacks, and peripheral vascular disease. So if you control your numbers, you prevent those conditions. So the Heart and Stroke Foundation is embarking on a lot of mass public awareness campaigns, such as this interview we're having today, to alert people what really is the fuss about this old condition called hypertension. It was there when our grandmothers are there. It'll be there long after we're gone. But it's really about preventing people from dying. And this is important because cardiovascular diseases, strokes, heart attacks, are by far now, in 2021, the #1 killers worldwide. If you consider, for example, globally, approximately 18 million people die from cardiovascular diseases, and you look at COVID and how much resources and finances we've dedicated to COVID in such a short space of time. And I think globally with COVID, we're probably approaching now just over 3 million, approaching 4 million globally in over 2 years. But 18 million annually, that's a staggering number. And so the foundation is embarking on this drive to alert the public, because only when the public is informed and are aware of their risks, then they can take responsibility for their health and prevent the sequelae of hypertension.
Dr. Tsabedze, thank you so much for joining us this morning and for everything that you've shared with us.
Thank you, and thank you for having me. I hope that was insightful for some of your audience.
Absolutely. En dit was dan die kardioloog Dr. Nqoba Tsabedze.